Hi, welcome to the Survivor Corps webinar series. My name is Diana Berrent. I am the founder of Survivor Corps, and we know that you can't always get to the experts, so Survivor Corps is here to bring the experts to you. And today we have Dr. Emma Guttman, who is the incoming chair of the Department of Dermatology at the Icahn School of Medicine at Mount Sinai in New York City. As many of you know, everyone who is involved in the COVID world is well aware of Mount Sinai, who they have truly been a real leader in this during this crisis. And we are so lucky to have Dr. Guttman here with us, who's an expert on both skin and hair loss issues that are becoming more and more prevalent, as we all know, in this COVID journey we're all on. So Dr. Guttman, can you just give us a little bit of a background on your practice, and then tell us what do you make of this long-term sequelae, these long-term symptoms? I don't know whether even to call them symptoms of COVID or damage from COVID. I mean, what is this? What's going on here?
Yeah, first of all, thank you so much for inviting me. I'm very excited to be here. And just a little bit about my practice. I'm a physician scientist, so I'm dividing my time between the lab and the clinic. In the clinic, I like to see primarily what my research is also about, and that's primarily eczema and skin allergies and a hair loss of multiple types. And that's also what I research in the lab. And starting in maybe March, we've seen really an alarming number of hair loss. And interestingly enough, we see it in both patients that had COVID and also in patients that didn't have COVID, because some of the hair losses, such as alopecia areata that I'll discuss soon, are associated with stress. But we see also in patients that had COVID, very severe alopecia areata that starts one day. Usually, alopecia areata, these are patches of hair loss. And usually the patients may have them for a while. They are being treated with injections of steroids, and they may progress to total scalp or body hair loss called alopecia universalis or totalis. But many times they stay stable. And right now we see an alarming number of cases that progress really in days between few patches to total scalp and body hair loss. And imagine how devastating this can be for patients. We did see it in many patients that actually had COVID at some point. But we also saw it in patients that just were very stressed due to multiple reasons. We have plenty of reasons right now, and also developed it. This is very alarming to us, because in this condition, it's really important, and in other hair conditions too, but it's important to provide help to patients in a timely fashion. So very important that patients are aware of this and come to the doctor.
Right. I mean, and to be stressed to begin with, and then to start lose your hair, it has to cause yet more anxiety. But is it this what's going on due to stress, or do you think that it's due to the virus? I mean, it must be some portion of it that's due to the virus. And what do you think the connection is between the virus and these ongoing hair issues, skin issues? I mean, I guess the skin is your largest organ, right? But
absolutely. Yeah, so we know now, and I'm an immunologist too. I'm very passionate about immunology and research. And we now know that when you have the cytokine storm of COVID, there are different immune molecules that are being activated or upregulated. And some of them are exactly those molecules that are actually involved in the initiation of these diseases, alopecia areata and eczema. And it may be that certain patients maybe had a predisposition to develop these diseases, but we now have the trigger, and it triggered it in a much more fulminant fashion than otherwise potentially would have been, or maybe they would not have had it ever.
Wow, that's interesting. So let's start off with hair, and then we'll move to skin. How about that? I've had the pleasure of actually hearing you talk about this before, and I found it fascinating, and I've repeated it to just about everyone I know. So I'm just going to leave it, before I even get into the questions, can you just sort of give an overall introduction to what's going on with hair loss, that there are different kinds and what to look for? So instead of me asking questions, I think we'll all benefit more just from hearing you talk for a little bit on this.
Sure, of course. So there are different types of hair loss, and they also look very differently. One very common type that is actually the most common type is telogen effluvium. Every woman experiences it right after. During the pregnancy, we have beautiful hair, and after pregnancy, in the first 3 months, sometimes 6 months, we have hair loss. It's all over the scalp. And usually it's temporary and we regain the hair back. Unfortunately, not all the cases are like that. Some of them turn to be chronic, but that's the minority. Most of the women are regaining hair. And the same type of hair loss we also have after a viral infection, after, let's say, after cancer treatments and some serious illness treatments, we can have a telogen effluvium. And in some of the cases we see now are certainly telogen effluvium, and likely they will regenerate their hair growth. In parallel to what we see, the telogen effluvium, we see another hair loss condition called alopecia areata. That's an autoimmune hair condition. And the way I like to explain to patients, think about an attack of lymphocytes on the hair follicle.
Okay, what's a lymphocyte?
Lymphocyte is it's an immune cell that attacks the hair follicle. So basically, the body attacks itself.
Got it.
And that causes a destruction of the hair follicle. And patients start losing.
It sees it as it recognizes an enemy. It's
Exactly.
it.
Yeah, the body recognizes it as an enemy and starts attacking it, and patients start losing hair. So sometimes it's localized. You lose a patch or 2 patches, and we treat it with injections, and patients regrow hair. Sometimes it starts like this and it progresses. And at the end of the day, patients will lose all the scalp hair, they will lose eyebrows, and sometimes all the body hair. So from the cases of alopecia areata, we think that around 15 to 20% are involving total scalp and body hair loss. The majority are more localized. But what we see now, and I think I didn't see it before, often you see that it takes a very long time for patients to progress from the localized type to the total scalp and body type. And now I just saw multiple patients in my office that in a month or 2, patients lost the entire hair. Extremely distressing to patients, multiple patients.
We have a lot of members who are experiencing this and buying wigs and all kinds of,
Exactly. This is extremely distressing to patients and to parents. We see that also in teenagers. And even earlier than teenagers, and the entire family is distressed over the hair loss.
So basically, if it's coming out evenly, you're in the first camp, and if it's coming out in patches, it's in the second camp, and that's when you need to seek help.
Yeah, I think in both cases you should seek help, because you never know what case, what this is. So I think it's important to seek help. For cases of telogen effluvium, we will recommend vitamins, and there are injections of a vitamin B complex, a biotin that most patients can take it, but some patients will not be able to take it, but the majority will be fine to take it. Anything that we can do to boost the hair growth, and eventually it will grow. For the second camp, the one that is autoimmune, for these patients, we need initially to do injections of steroids when it's localized. But when it's involving the entire scalp or a major part of the scalp, then you need to give systemic treatments. And it is important that they come early so that we start the treatment early.
So for the hair loss that will come back on its own, how long are we talking? Because, that's sort of the big question. When is it going to come back? How long is this going to take?
Yeah, so, it's individual, patient by patient, but anything regarding hair takes a long time, because the follicle is really quite deep, and it takes a long time for hair to regenerate. But what typically patients will see first is that they stop losing more hair. So I think that's the initial good sign. When you start to see that you stop losing hair, then you should expect that more hair will generate over time.
And are there, I know that a lot of people are afraid to brush their hair because every time they brush their hair, there's so much hair on the brush that, I don't know whether it's the fear of seeing it or that they're going to be taking more out by brushing it. Should you avoid brushing your hair? Or should you shower more, shampoo your hair more or less, or condition more or less? What can you do with all of that? And yeah.
Yeah, no, that's a wonderful question. And I think this is a myth because it doesn't really matter if you brush your hair more, if you shampoo more, whatever you need to lose, you lose regardless.
Okay.
I actually tell patients that they need to do what they need to do to keep the hair healthy and look good and shiny. And in fact, I think it's good to wash your hair almost every day if you can. But definitely not wash once a week. It will not help you in this respect. So do what you need to do. All these cosmetic things I think are actually important for the patient to feel good about themselves. And the same with coloring, right? Patients are asking, can we color our hair or it will damage it? I don't think it will damage it. I think we need to find the source and treat the source because these are all things that will not matter to the hair growth.
Interesting. And are there health concerns with this, or is it really just an appearance issue? I mean, clearly there are psychological, it's a devastating thing to happen to you, and I don't want to minimize it, but is there any health risk, or is it a modesty issue?
So I love this question because, now alopecia areata was used maybe 10 years ago. And this is why maybe drug companies 10 years ago were not really focusing on developing drugs for it because it was considered this cosmetic disease, right? Patients don't have hair, even though it's devastating. So now we understand that alopecia areata is considered, has a systemic immune abnormalities. In fact, we published a paper. It's very interesting. We compared alopecia areata to psoriasis and atopic dermatitis, two diseases that are considered when they are chronic and moderate to severe, that there is a lot of systemic inflammation in these patients. And we found that actually patients that only have hair loss, but don't have any redness anywhere in their body, so no visible inflammation, they actually have more systemic inflammation than the patients with the other two diseases. It's fascinating. So that means that, yeah, that's fascinating. And there is now a large bulk of data that there are comorbidities associated actually with alopecia areata. So it doesn't come only by itself, So it's super important to treat it early because it is a disease that has systemic immune abnormalities beyond the skin.
That is very good information to know. So you mentioned biotin, and some have said that they couldn't take biotin because of thyroid issues. I've taken it for a long time, but if you can take biotin, what kind of supplements are good for your hair? Do you have any product recommendations for us?
Yes.
To the drugstore?
So I have to say, when I joined Sinai quite a while back in 2011, I saw that people were given injections of vitamin B complex. And at the time, I was a little bit suspicious of this, I must say, but I do see that it helps. It helps patients primarily retain the hair that they have, because I think our first task as dermatologists is to retain what patients have. And then as a second step, regrow more. And I do see that if you do it, so what I recommend to my patients to try to do it every month, to come to your dermatologist and do these injections. They are actually not in the scalp. They are actually in the butt.
That was my next question. That was literally my next question. When you say shots, where are you shooting?
So they are in the butt. So, it's not fun, but I do think
I'd rather that. There's a lot more fat there than on my head. So
but I do think they actually help. So I think that's a good way to go.
If you experience this sort of hair loss, does that mean that it's something that you are going to, that okay, comes back, is this now something that you're susceptible to and it will happen when you are stressed again? Does having it once prime you to have more episodes is what I'm asking, I guess.
So you are asking about the telogen effluvium?
Yeah, I don't know how to say it. I'm not sure.
Telogen effluvium. I know it's a very, dermatological names are very difficult.
Telogen effluvium.
Effluvium.
Correct? Okay.
Yeah. So, it's hard. That's an excellent question. So I think any stress on the body can bring it, but it has to be a major stress. So usually just a viral infection, if you have the flu, will not do it. It just tells you how this pandemic is not the usual flu, right? For many people, this is a huge stressor on the body. So it needs to be a really major stress on the body.
Okay. Should we move into skin or anything more on hair?
No, in terms of hair, I think the good news is that now we have, for example, if somebody develops total scalp or body hair loss, we have good treatments to treat in clinical trials. And I think we will have a revolution in the treatment of these conditions. We see patients that have zero hair on the body and regrow full hair. So it's a very hopeful time. For me as a dermatologist, I think it's a hopeful time. So don't look at just the moment that you lost hair. Just think that there is hope and you'll be able to regrow it.
Okay, good. You just made a lot of people very happy. One last question on the hair. If you're only losing it on your head versus other parts of your body, is that indicative of one thing over another?
So, usually they are linked. So we see many patients that lose it in the beginning on the scalp, and it's gradual. Unfortunately, they lose the scalp, then they start losing some portions of the beard, the eyebrows, the eyelashes. And I have to say, I talked a lot to patients. I think the worst for patients, because they say, you know what, we can put a wig on the scalp, but for them, the worst is the eyebrows and eyelashes, because that really changes the image they have on themselves. It's very devastating, and it's hard to replace these areas. So the hair is devastating, but losing eyebrows and eyelashes, I think, are the worst for patients.
Okay. Is there anything that you can do to prevent this from happening? Or it's
something... Yeah, it's so sudden for many patients, to the point just last week I had a patient that said that in fact that patient had a COVID infection about 6 weeks ago, and following the infection she was very sick. She didn't feel well afterwards, and one day she says she got up in the morning and half of her hair was on the pillow. Can you imagine? It's devastating.
Yes. Okay, let's move to skin now. So before I ask questions again, I think it's best to start out with a topic like this. Tell us what's going on. Explain, give us dermatology 101 vis-a-vis COVID.
Sure. So another disease that is my bread and butter in my clinic is eczema. And actually, eczema is the most common inflammatory skin disease in general.
The number one question we have here.
On eczema. Yeah, it's the most common disease.
In eczema.
Right. And, eczema is another disease that is highly linked to stress. And eczema is also very prevalent in the American population. We have 7% of the adults and 15% of the children. So it's a super prevalent disease.
Right. When you say stress, I mean, one of my kids had eczema as a baby. That couldn't have been from stress.
No. So there are two types of eczema. So first of all, if you have somebody in your family with atopy in general, and atopy is eczema, asthma, seasonal allergies, you are likely to develop eczema. And there is the eczema that develops in the babies. It usually starts at 3 months. And luckily, the majority of the babies will outgrow it, right? So there are different numbers out there, but we believe that maybe by In 5 years of age, 50% of the children will outgrow it, and by 10 years of age, 75% of them will outgrow it. But think about it, 25% don't outgrow it, and they will go into adulthood and will have eczema in adulthood. Now, there are a lot of those.
Wait, before we go on, what is eczema though? We're
So,
talking about it, but I don't really understand what it is.
So eczema is a very itchy red rash that usually starts in the folds, like
In your arm.
here and behind the knees.
What my daughter calls the knee pits.
Exactly. In children, you can also have it, right? In babies, you have it on the face. Those babies on the face can be on the upper trunk and the back. But for some patients, unfortunately, it's all over the body. And it's terribly itchy. When it's bad, it can prevent you from sleep because all you're doing is itching all the time. And when patients have severe eczema and children, it can interfere with school. I have a lot of children and adolescents are homeschooled because they simply cannot go to school. I have patients that it almost led to a divorce. The wife was telling them, "You're shedding too much scale. It's disgusting. Move to another room." Lawyers that had to close their offices. It interferes with the entire life because it's a terribly itchy condition, and that itch can drive patients, insane. Itch is the hallmark of eczema. And you can imagine if you have one or two patches, you just itch locally, like itch your hands or the face. But if it's all over the body, you can't sleep.
Yeah, I had a virus many years ago that presented as a very itchy sort of Christmas tree shape. I forgot what it's called. And after a month or so, I mean, the virus wasn't a big deal, but the sleep deprivation was the greatest torture I have ever experienced. I thought I was going to lose my mind from the sleeplessness, from the eczema, from the itchiness, not from the actual virus. That was nothing. It was the sleeplessness.
No, yeah, and it's interesting that you say that. I have quite a few patients that have cancer and eczema. And just recently, a patient that I have with severe eczema told me, I have to tell you, everything that I went through cancer is nothing compared to this itch that keeps me out at night.
Yeah.
It's very bothersome.
Yeah, well, I'm sure that's very validating for a lot of people listening right now to hear who are experiencing this in the extreme. We are seeing what are referred to as COVID bumps. We are seeing bumps and lumps and rashes of all different shapes and sizes. And some of it is quite alarming. I had sent a photo to you earlier. I think we can get it up on the screen here.
Mm-hmm.
We can take a look at it together because I thought I'd seen so many that looked just like this.
Mm-hmm.
So this is an 18-year-old girl who had COVID, a mild case of COVID about 8 months ago. So extremely mild case. And had some GI issues and then started presenting with this over the summer, and it's just gotten worse and worse and worse. And you can see the nails are thick and yellow. The skin on the bottom of the foot is peeling off. You can see how swollen her foot is, and she's just in extraordinary pain. Is that eczema?
Yeah, so this to me looks like the end result of something we call a dyshydrotic eczema, which are blisters on hands and feet that are extremely itchy.
They initially thought it was hand and foot, or mouth and foot. What's it called?
Hand and foot disease. Yeah, exactly, which is a viral disease.
Originally, it was misdiagnosed as that because it was on the hand and the feet.
Yeah, so to me, it looks like a dyshydrotic eczema that is super itchy. And actually, it's debilitating because patients, when it's like this, they cannot sleep.
This girl reported being in extreme discomfort, really debilitating.
And they cannot actually step on their feet. It's extremely painful. I see some patients coming to my office in a wheelchair when it's like that. And we started to talk about the fact that most patients outgrow eczema, but what we now see, and we see that once in a while, again, with a major stressor, we see patients that had eczema in childhood. It went away completely. And now after they had COVID or because of the stress of the situation, the eczema comes back. They didn't have it for 30, 40 years or 10 years. And suddenly it comes back due to this condition. We see quite a lot of these.
That's remarkable because I mean, I think of eczema and I think of a little bit of a rash. I don't think of that. I mean, do you think that there's a vascular component of that? I mean, the toes look so swollen. It looked like what are referred to as COVID toes.
So that's an excellent question. From what I managed to see, I actually think here maybe not a vascular component. We need to realize when there is a inflammation, and when I say inflammation, when you see that redness, it means that when you look deep under the microscope, you will see a lot of inflammation, and that leads to that swelling that you see basically.
And the tips of her fingers were swollen, and the tips of the toes that seemed to, like, as if it looks like there had been like a rubber band put around.
Exactly. So everything was swollen, red, and scaly. And when we see that, we have to treat what I usually recommend when it's severe. Topical treatments work so far. Sometimes they are not enough. So many times we need to put on board some light treatment, phototherapy, that is able to alleviate it, and sometimes even some systemic medications. But it's extremely painful and definitely needs treatment.
Oh, okay. So if you were experiencing that, go to your dermatologist and say, I think can you check me out for eczema, for extreme eczema?
Mm-hmm. Absolutely. Absolutely.
Okay. Okay. But a lot of people are being really shuttling from specialist to specialist. And while it might seem clear to look at something like that, and of course it's a skin condition, we're going to go to the dermatologist, but people are being sent to rheumatologists and this person and that person. And so sometimes the best piece of advice is just which doctor to go to for what. And with COVID, it's often hard to know.
I completely agree. I think I'm a great a proponent to go to people that specialize in something. For example, when I see such a picture like that girl, another thing that needs to be done, and there are not so many people in New York that specialize in it, I would also do some allergy testing, because once you have eczema, you will have also more allergies and more irritation, because the skin is broken, so things will just penetrate. And when you see that, you need to understand whether there is a superimposed allergy to something like nickel, rubber, some other metals that can make her condition worse, because many times, even though we give treatment, the treatment is not enough because we didn't take away the allergy. So very important to go not to any dermatologist, to find a specialist that is a specialist for that particular condition, whether it's a hair loss or a eczema. I think it's very important to go to somebody that really understands what you're going through.
So that's really important to know. I mean, so just to continue on this vascular question, because I'm a little bit obsessed, and someone else wrote it in, it wasn't me. Could a post-COVID rash indicate poor blood flow, being prone to blood clots or other vascular health complication?
So again, it depends which, I think as dermatologists, we are able to understand which ones may be in the eczema route, like this patient, and which ones are vasculitis. For example, if it's a vasculitis, when you touch it, it will not blanch.
And blanch means to turn white, correct?
Exactly. So. Whereas in eczema, it will turn white, and it's that scaliness you see that she had, that I, as an experienced dermatologist, will tell you that that's likely eczema, but we have means to know. Now, if somebody is unsure, for sure we can do more studies, and always it's better when you are not sure, either refer to a specialist or do the additional studies, because you don't want to miss a vasculitis.
What is vasculitis?
So vasculitis is inflammations of the vessels. and those need to be treated, taken seriously, of course. And it's also sometimes relating to vessels that are not only in the skin. And you need to think about doing a workup of autoimmune conditions. And it's very important to be minded to that. So if you,
what would it look like?
so it will usually look violaceous. It has that violaceous look. Violaceous, I mean, it's not blanching. It will look, first of all, it's also a little bit edematous, so it will look swollen. There will be that violet type of color, a bluish violet color, usually on the lower extremity, many times all over the lower.
Is it a small patch? Is it like a dot or like a patch?
It's kind of blurry patches on the lower extremities many times.
Interesting. Okay. Can we go back to the allergies for a second? Because we're getting a lot of people reporting brand new allergies. Is that common after other viruses that people or other trauma that people just develop new allergies? Is that a common thing? And, what's going on with that?
So, I think it's linked a little bit to eczema. You know how we said that once you have eczema, you tend to have also more allergies.
Right. And you mentioned asthma and allergies.
Exactly. And skin allergies, we see also in a higher proportion of patients that have eczema. So, and it depends what allergy, but I do think they need to go and get tested. The testing that is being done is patch tests. And again, it's important to go to a dermatology specialist to get the patch tests. And, there are different allergies to rubber, for example. You need to think about rubber when it's on the hands, or metals, people that go to the gym, lift weights. Or you need to think if somebody has rashes on the scalp, you need to think about hair color or hair products. This is a large part of what I do, but you need to act a little bit as Sherlock Holmes and think what is the patient touching, and according to that, design a patch test that suits the patients.
I mean, there was a lot of reporting over the summer about increased response to mosquito bites. Is that something that you've seen a lot of?
So that's actually, it's an interesting question. That's something that is the characteristic of eczema. When patients have eczema, they have
back to the same I feel like we're playing a board game where everything leads back to the same.
Yeah, so patients with eczema have these exaggerated reactions to bites, like you get a bite.
Yeah, and it'll turn into a welt.
Exactly. Yeah. My daughter has that, and she has eczema. And this is how I got interested in eczema. I myself have, now it's mild, but I used to have a much more severe eczema once upon a time.
So that's indicative of it. Do you think that the people who had those allergies this past summer are going to have them next summer when the mosquitoes come back? Or do you think that that's enough time for the system to calm down? I mean,
so I think once you have eczema, it's in your system. You just need to learn how to treat it. But once you have it once, it's dormant. It's there. Even if you had it as a child, that's why for us as dermatologists, it's important to ask patients if they had eczema. And sometimes they say, oh, yeah, I didn't have that dry skin when I was a baby. They forgot all about it. But once you have it, you are prone to develop it again at any time in your life, or develop asthma or other allergic manifestations.
We were talking before about that photograph, and you were talking about blisters. So a lot of people are reporting that their skin is literally peeling off. And so I just wanted to clarify, because I feel like the answer might have gotten a little bit lost in there. And I know so many people are asking this question. Is the skin falling off, or are those blisters that are popping, for lack of a better medical term?
So if indeed these people have what I've seen in that picture. That looks to me like a form of eczema.
On the bottom of the foot, there was
That's it.
the bottom of the foot is where the skin looked like it was peeling off.
Yeah, so usually it's very characteristic for hands and feet.
Yeah.
You have blisters. When the blisters are resolving, right, they peel off, and they tend to recur. If you don't give the patient treatment, it will recur. And it's incredibly itchy, this condition. And once you have that, you are also more prone to develop eczema elsewhere. So definitely it's important to treat it.
Are there any foods that are known triggers or?
So, this is a question I get all the time. And there is this myth that foods are causing eczema or exacerbating eczema. And truthfully, there are no studies showing that. In fact, in babies, eczema is the first thing that happens, and only afterwards the food allergies happen. And actually, severe eczema is the one that will predispose to food allergy, not the other way around. So it's not the foods that are
the underlying thing, not the allergy.
Exactly.
Oh, I always thought it was the other way around.
Yeah, this is a kind of a myth that people think, but we now believe that actually eczema is the window to all the allergic diseases. And in fact, we now discuss a lot, because we have now good treatments for eczema, that maybe giving babies prevention very early, we may be able to prevent the entire allergic disorders. But that's for much later in the game. This is work in progress.
So a lot of people are reporting, I speak often about long-term COVID aging people. And when you look at pictures, I look at people's profile pictures sometimes, and I try to reconcile it with the photos that they're posting in Survivor Corps. And it looks like the photos are from 10 years ago, when in fact they're from 9 months ago. This disease seems to be aging people decades in a matter of months, not just, yes, physically, internally, but also externally. People look older. Their skin, people are reporting their skin literally aging, getting crepey, kind of a crepey quality to it. What is that eczema? Is that tell me?
Believe it or not, I do think it's a form of eczema too, because when you have eczema, one of the very characteristic manifestations of eczema is you have under the eyes, you have that wrinkling under the eyes.
Yep, got it.
And that's super characteristic of eczema. And when you have eczema in multiple locations, think about the fact when it heals, there is that sagging of the skin, right? Because first you have eczema, and there is that, we discussed that there is that inflammation, and you have
like a scarring a little bit.
It's just the wrinkling of the skin, exactly. The wrinkling of the skin that happens.
So when that regenerate then, right?
Usually it regenerates, but it doesn't regenerate very well under the eyes. Under the eyes, people will still have that wrinkling. In most of the areas, it will regenerate, yeah.
Okay, well, since we're here, how do we get it to regenerate under our eyes? I know it has nothing to do with COVID, but we might as well get a little bit of vanity out of this, since we haven't. We need to correct it. Sorry, everybody, off topic for 1 second, but what do you do?
Yeah, no, so, I think now with a good treatment, and some people necessitate actually systemic treatments, it does regenerate. When there still is some sagging skin, they may need some intervention in that area. But I think the best is my best advice is to treat it early. Don't get to the point when you have it severe. Now there are amazing treatments, really amazing treatments that are also safe. We care about safety. In fact, we are now investigating some, as you and I discussed, as potentially being attenuating COVID-19 responses. So I think now the message to patients is to seek treatments. They are not going to be detrimental in this era. In fact, some of them may be protective, potentially.
Are you able to talk about that study at all, or?
So,
or should we save that for our next one?
Yeah, maybe we should save that for the next one.
We'll save that for next one. So, I guess everything it's all what you know. So a lot of questions that we get were like, this looked like chicken pox, chicken pox type blisters, or or these blisters related possibly to Bell's palsy, or, this skin condition ended up being diagnosed as lupus. Is it just that we're connecting all these things because we had COVID, or is COVID causing I mean, obviously no one's getting the chicken pox from COVID. I didn't mean that. But these blisters, is there any relationship to Bell's palsy? Is there any relationship to lupus, or is it just skin issues that are happening from COVID that can be confused with these things? There are just so many diagnoses that are being thrown around right now, and it's hard to really peel apart and understand what is related and what's not.
So clearly, if you had COVID, that's a major stressor on the body. And one possibility is that you have these blisters because you developed eczema. Very likely possibility. The second possibility, if it's localized to only one side of the body, for example, and this is another condition linked to stress, you may have something called eczema herpeticum or herpes zoster.
So is that a type of herpes or a type of eczema?
Herpes zoster is a type of, it's basically people that had chickenpox. The chickenpox virus stays in their system, and then at some point in their life, and
shingles.
Yeah, shingles, exactly.
Got it.
Yeah, exactly. So that may be because, and that's very painful. The characteristic of that, it's not so much itchy, it's very painful. But if itch is the primary characteristic, then likely it's the eczema. And when you have eczema, there is another manifestation that we need to be aware of. If you have eczema that is not treated well, then you can have eczema herpeticum. What does it mean? That the herpes virus comes on top of the eczema patches, and then you have these tiny characteristic blisters that are both itchy and painful on top of the eczema. And definitely that necessitates immediately going to the doctor.
Okay. As I lick my lips, I'm getting to the question about chronically chapped and cracking lips, and could they be COVID related? If so, why?
Yeah.
Not my question. I was just coincidence.
I don't think this is related to a COVID, but I do think it's linked, right? When we are stressed, many times we lick our lips. And actually, when many patients with eczema will also have, because in eczema, you have dry skin, right? Eczema is very linked to dry skin. In fact, that's the first thing that happens in eczema. You first have dry skin, that dry skin is itchy, then you have the patches. So when you have eczema, one of the first manifestations actually can be the dry lips. And my best advice to patients is counterintuitive to what you would think, don't lick your lips. Because if you lick your lips, you create a cycle that we need to break. And we need to also think about the fact that when they are cracked, you can also insert some infections. So try your best to have nearby some lip balms, or just simple ones, Aquaphor, Vaseline. Just moisturize your lips and try not to lick your lips if possible.
A lot of questions came in about post-COVID cystic acne.
Mm-hmm. We see that a lot. That's one of the things that we see really a lot in the clinic, and particularly in the area where you have the mask. And particularly in people that sweat a lot.
Maskne.
Yes, maskne. Yeah, we see that.
Well, that was another question is about perspiration. We've had a lot of people either night sweating profusely during the day, hands and feet all of a sudden getting extremely sweaty.
And by the way, sweating is one of the things that makes eczema worse. And when you sweat, in fact, patients with eczema do not do well in conditions where they sweat. And that can happen in the winter when you have excessive heating, or in the summer when we have very high temperatures, or when we do exercise. Another thing that we need to remember, patients with eczema, when their eczema is severe, cannot tolerate exercise. And the reason being the sweat.
Oh, that's good to know. Well, I mean, I'd say that most people recovering from COVID can't really do much exercise either, and exercise is seeming to be the worst thing for people. I mean, not medically that I'm saying that, more that people are, when you try to exercise, they end up on the couch for 4 days as a
Oh, God.
result. Um,
Wow.
that it does not seem to be met well by people's bodies in general. Um, so how do you treat the perspiration issues?
So when people have it on the face, I tell them that first of all, they need to look into maybe changing the mask. Many times there are differences also in masks, and there are some masks that are also causing some irritation. We've seen that too, depending on the material of the mask. And maybe allow more space. You know, there are differences in masks. There are masks that are really rubbing all the time on the face. There are masks that allow more space. So some people need those that allow more space. And I also tell them, listen, wash your face with soap and water even 3 times a day. And I give them some topical treatment, and some I gave them antibiotics because I have actually adults with almost scarring acne, like
Yeah.
big. Yeah, it's a major issue for patients that didn't have acne already for 20 years and suddenly they have it now. I also tell them that try as much as possible to give yourself some break, go to the bathroom, remove it a little bit, wash your face, and maybe change your mask.
Okay. And how about the sweating on the hands and the feet? What do you do about that? I mean, and what's
So
causing it?
that's what I actually like to do. I like, there are some body washes that are quite effective, such as Hibiclins. They are over the counter.
What is it called?
Hibiclins, Hibiclins, Hibiclins. They are in blue bottles. They are antibacterial, and actually they are quite effective. I, for example, I do an allergy clinic, and there are patients that, for example, are allergic to deodorants, to ingredients in deodorants. And I actually advise them to use Hibiclins because it's actually quite effective in reducing sweat also in the underarm. So you can, yeah. So this
And
is an
you can
alternative.
use it, and you use it on your entire
Yes,
body,
on the entire body. It's quite
and
effective.
it's not clogging anything up by
Not,
preventing you from sweating or
yeah,
anything.
no, nothing. So I tell patients
Yeah.
when that's what I'm advising my eczema patients after exercise to come immediately home, shower. They can shower with the Hibiclins. But yeah, it's quite effective.
That's a great piece of advice. I'll be going on to Amazon right afterwards and buying that. What kind of medical tests, we talked before about, what kind of dermatologist do you go to for particular issues? What kinds of testing should people be asking for when they're encountering these issues? If you're going to a doctor, let's say you don't have, not everyone has access to specialists, someone who specializes in particularly hair loss and eczema within dermatology. I mean, if you're in a small town and there's one dermatologist, that's going to be your dermatologist. So, or if there is one at all. So if you are having to bring ideas to your doctor of, what questions should people be asking of their doctors?
So first of all, one good advice to patients now, and this is something that actually COVID changed the way we treat patients, and I think it's here to stay. While of course we prefer to see patients in person, we enable teledermatology, right? So even if you are in a remote place, you can have access to world-class dermatologists. For example, we at Sinai are doing teledermatology, and you can actually have access to doctors. Now, it's not ideal. It's not like seeing somebody in person, but for most conditions, it's good enough to understand what's going on, and that can have a follow-up later. So that's because I think it's good to go to people that have seen this. My advice is to go to doctors that specialize, even if it's via teledermatology. That's better than some doctors that never saw, for example, a cosmetic dermatologist that doesn't treat medical dermatology. I don't think that's the route that they should go for. They need to go to a medical dermatologist.
Um, And how would somebody contact Mount Sinai if they want to? I mean, can you do that from anywhere in the country, or can you practice telemedicine from one state to another with
Yeah,
it?
that's an excellent question. So, yeah, we are now, we did some emergency licenses for areas that we see patients a lot. And that I think enabled more people to have access to us. And we had a lot of contact with patients that had a COVID. We saw during the March, April, but all the time we see, and we have a lot of experience.
Right. I mean, I guess New Yorkers have that claim to
We had
fame.
our share. Yeah.
It's coming back. So because there's nothing better than getting a good tips from a dermatologist, what other sort of basic products would you recommend that people have access to, that could buy on Amazon or whatever to deal with some of these issues, to at least provide some comfort in the meantime? Or, if you're waiting for these things to resolve, or you're waiting for your doctor's appointments, how can people get some sort of relief from the itchiness that they're experiencing, the pain that they're experiencing, the skin issues? What do you recommend?
Sure. So first of all, for the hair, just buy a mild products. It's fine to wash your hair even once a day, but don't use things that can harm your hair. Use mild products. And generally speaking, I like things that have a minimal number of preservatives and a minimal number of ingredients. The more ingredients, the more you have chances that this will be irritating, or you'll develop some allergy to something.
I don't think I've ever seen a shampoo that didn't have 150 ingredients. Where does one find such a thing?
Yeah, so when you do not know, go for the baby ones. These are very safe. There are some brands that are for people with sensitive skin, like Cetaphil, CeraVe, that also have associated shampoos. Pick good moisturizers. That's very important. Again, not with a lot of perfumes, because some patients are allergic to perfume.
I was going to ask you if we should be avoiding scented products.
Absolutely.
It feels like everything is scented now. People don't even wear perfume anymore, right?
Yeah, no, I completely agree. And I would go for the unscented products. I think you made an excellent point.
And detergent too, I was told that unscented detergent and fabrics, like those sorts of items, can also.
Absolutely. Absolutely. So, I'm doing an allergy clinic, and we have a lot of patients with different allergies to perfumes and fragrances. So when you do not know, before you have your doctor appointment, try to minimize the contact with possible allergens. What are the possible allergens? On one hand, there are the fragrances, really top allergens, and the preservatives. So when you see 100 ingredients, that's not a good idea. So just buy
like with your food.
Exactly. And sometimes, believe it or not, cheap is actually the best one. You don't have to go, you don't have to go to the very expensive ones with 150 ingredients. Just pick something that, for example, pure old Vaseline works as a moisturizer. When you do not know, you can just refrain to something very simple.
Right. I use the Pond's cold cream that my grandmother used to wash my face every day. Seems to work.
Exactly. If it works for you, don't.
Right. It certainly is the right price. So people did ask about using natural products like rose hip oil, jojoba. I don't know how to pronounce that. Jojoba, jojoba. I don't know.
Yeah, jojoba oil.
Witch hazel. Any recommendations, pro, con? Does it work? Does it, anything will massaging your head stimulate the hair follicles? What sort of magic tricks are there?
So first of all, you brought an excellent point. One word of advice: the so-called natural products, they are actually the most unregulated. And we actually, when we do allergy testing, believe it or not, when do we see the issues? It's many times with the oils, they have fragrances. They are not regulated. It's really anybody's game. And what I do in my own clinic, I also always test for the actual product. And many times we find in them a different ingredients. So I actually tell patients, go for products that you know exactly what's in them, not products that you buy in shady places. If you don't see the ingredients, never ever buy such a product, particularly when you think you might have an allergy.
That is good to know. I think that we've actually, I didn't ask about hives. How could I skip hives? What do you suggest for the treatment and prevention of hives?
Yeah, so for hives, luckily, actually, many treatments are over the counter. Antihistamines, we have multiple over the counter. You have Claritin, you have Zyrtec, you have Allegra, you have Benadryl. Benadryl puts you to sleep. So what I tell patients to do, some patients like the idea of something putting them to sleep, but not always. Like you'll not advise it a high school student, you know. So
I'll never see them again.
exactly. So it's very important. And I tell parents, because some parents send the kid to school with a Benadryl. That's not a good idea if you want the kid to perform. So it's very important to look at the label and during the day, go for something like Zyrtec or Claritin or Allegra. These are not going to make you sleepy. And if you want to sleep better at night and have some antihistamine effect, go for the Benadryl. But consider that if you have an exam the next day, you shouldn't take it because it may make you even drowsy in the morning later.
All right, I've had that. Okay, I think we've gotten through all of them. I'm going to just give you the one last question. I can't help myself. Best drugstore moisturizer?
So, I myself, I'll tell you what I use myself. I like the CeraVe Healing Ointment. It's a simple one. I like because it's between a cream and an ointment.
Right.
And, ointments are very greasy, but you need the grease. So it's kind of an in-between. And this is what I like myself, CeraVe Healing Ointment.
Perfect. And so not only do you come to Survivor Corps to deal with COVID, but you get beauty tips. So thank you so much, Dr. Guttman. We are so appreciative of your time, your expertise, your knowledge. Do you have any parting words for our crowd?
No, I want to end with a hopeful thing that while there are manifestations out there that scare you, there is help out there. So I want to end in a hopeful note.
Thank you. We all need some hope. So that's a perfect note to end on because, as I always say, Survivor Corps is the epicenter of hope. Thank you all for attending this week. Thank you, Dr. Guttman, and we'll see you next week. Bye-bye.
Thank you so much. Bye-bye. Thanks.